How do we treat it? Well, outside of time, the big things are just treating for any vomiting or nausea the patient may have. I typically will send these patients home on Cerenia. Most of the time, I get better results with 2 milligrams per kilogram SID than I do with 1 SID or 2 BID. I don't typically use this drug BID. I typically use it SID at 2 milligrams per kilogram, or I fit the patient to the closest tablet size that'll work for them. Meclizine is over the counter, and so it's really easy to pick up. Most pharmacies will carry it. It goes by the trade name Anavert as well. There might be some other ones out there. Those are the ones that I run into. I will use this once or twice a day, and it's 12.5 to 25 milligrams per dose, not per kilogram, but per dose. I typically use the smaller dose and once a day on smaller patients that don't have bad nausea or vomiting. And I'll use a higher dose on bigger patients that might be having some vomiting and appetence or nausea. And so just use your best clinical intuition based off of that. Luckily, most patients don't have any true motion sickness, but I do see some inappetence for a day or two after the initial onset of signs. And it's the question of, is that more stress related or is that truly motion sickness? Some of these patients will be worse after transport to the clinic because the car throws off their entire system. And so that travel can make them worse. So something to consider when we see these patients, especially when we discharge them and they're heading home as well. Just want to reiterate that to the families.